So today we're going to be talking about how we can apply reading in an English language to cracking the code when it comes to nursing questions. Objectives are going to be about applying critical reading skills to nursing exam questions, breaking down complex questions systematically, and then showing you that framework for analyzing questions effectively. And this matters because nursing exams, test comprehension, application, and analysis are important to understanding how to improve on your test performance as well as improve your critical thinking in the clinical setting. So there are 5 critical comprehensive skills that we all have the ability to do. And this is about looking at our background knowledge, recalling relevant concepts from past studies. Then we identify the purpose or main ideas, like determining what the question is truly asking us about. Then we identify key details that focus on crucial information within the scenario. And then we compare and contrast and categorize information. We're actually differentiating between similar conditions or interventions. And then lastly, we go about drawing conclusions and making inferences and predictions by applying logical reasoning to make sure that we're selecting the best answer. And if you think about this, this is definitely exactly how we learned in elementary school how to read information, to analyze the information, to draw conclusions on what the information is about. And so we're applying that initially to just the 5 critical comprehensive skills. Now, as we put that into a framework to analyzing nursing questions, we're just going to take it another step forward. Now, in activating the background knowledge, we're going to recall disease processes, symptoms, and diagnostic tests. And we're going to connect question content with real-life patient cases or textbook knowledge. Then we're going to identify the purpose or the main idea. Is the question about a diagnosis, an intervention, or is it a prioritization question? So you're going to be looking for keywords that define what your focus is going to be. Next, you're going to identify key details by extracting the most relevant symptoms, history, and findings from the question. Then when you go on to the next step of comparing, contrasting, and categorizing, you're going to rule out incorrect information by matching symptoms to the best fitting diagnosis. Then you're going to draw your conclusion and make inferences. You're going to determine which answer aligns with evidence-based practice. So we're going to start with a little bit of an example here. So we have a scenario. A patient presents to the clinic with multiple symptoms that have been ongoing for several months. The client reports experiencing, now here's things that I want to pick up: heart palpitations, shortness of breath, dizziness, and a constant feeling of unease. Then they have repeated ER visits where cardiac tests are normal. They have trouble sleeping, difficulty concentrating, and social avoidance due to fear of experiencing symptoms in public. The question asks, based on the client's presentation and the scenario described, which of the following is the most likely diagnosis? Now, I want to keep it clear that as nurses, we do not diagnose, but we can hypothesize what might be going on with our patient to determine what we're going to be doing for them. So in this instance, our choices come as myocardial infarction, pulmonary embolism, hyperthyroidism, or generalized anxiety disorder. And now we're going to take those steps that we learned and we're going to put them into play. Step 1 says activate background knowledge. What do I know about each condition? Recall common symptoms and diagnostic findings. So your job is to recall knowledge about common symptoms, presentation of myocardial infarction, pulmonary embolism, hyperthyroidism, and generalized anxiety disorder. What do you remember about those? Then you want to relate the scenario details to your previous experience or study sessions that involve these conditions. The next step, we're going to ask ourselves, is the question about a diagnosis, an intervention, or is it about prioritization? Look for those keywords to define what your focus is going to be. The main idea is to determine the most likely diagnosis based on the symptoms and the scenario that was provided. So you're going to focus in and identify that the question is about hypothesizing a diagnosis given a set of symptoms. Next step, step 3, we identify the key details. So the details in a scenario, they had heart palpitations, they had shortness of breath, they had dizziness and constant unease. They had a normal cardiac test result. However, subjective information from the patient says that they have trouble sleeping, difficulty concentrating, and avoidance of social interactions in public places. It's important to also look at that and understand that these details help you as a student to narrow down what those possible conditions might be. As you get to step 4, you're going to compare, contrast, and categorize your information. So when you look at myocardial infarction, you're going to look at severe chest pain. You also have, with myocardial infarction, you will see severe chest pain. They will have often this pain that's radiating, and they will also have abnormal cardiac tests. Now, when you look at that, and you look at that information, does it fit to the scenario that we had? It really doesn't. So in my mind, I'm ruling out myocardial infarction. When I look at pulmonary embolism, it's usually an acute onset chest pain with deep breaths related to immobility, surgery, abnormal imaging. And when I go back to look at my scenario, none of these really fit. The symptoms are chronic, not sudden. With hypothyroidism, weight loss, heat tolerance, increased appetite, abnormal thyroid levels, those are the things that I think about. And so they don't really match the scenario of my patient. However, when I look at generalized anxiety disorder, chronic symptoms, no physical cause, triggered by stress, normal test results. And this best fits my scenario. So based on the comparison, I would categorize each condition to see which best matched the scenario that I was given. Now, sometimes with questions, you have to draw conclusions, make inferences, and make predictions. Inferences, given the chronic nature of the symptoms and normal cardiac test results, conditions with acute onset or abnormal test results A, B, and C are less likely. So the conclusion would be that the symptoms align most closely with the generalized anxiety disorder, as these include these symptoms that don't really have a direct physical cause and it's triggered by stress. So some takeaways is recognizing patterns and symptoms that help rule out incorrect options. Understanding the test format helps you as a student choose the best possible answer, and then practicing systematic breakdowns of questions to improve confidence and accuracy. And so the final answer is D. What do I want you to take away from this? I think that there's an atmosphere in which students believe that the person who finishes first wins the reward. But in nursing, it's the person who reads the complete question, the complete answer, and breaks it down that wins the reward. It takes time. Reading is critical. It's a critical skill to help master, but also to help improve your ability in not only breaking down questions and answering them, but also to engage in that piece that we need you to do, which is clinical judgment. And success in nursing exam comes from that structured thinking, not memorization. So my encouragement is for you to take this framework, start to implement it in future nursing questions. And if you have any questions, just feel free to reach out. It's Nurse Ease, Nursing Made Easy.